Welcome back to the Profit Lifestyle for Fitness Entrepreneurs. Of course, I am your host, Scott Carpenter. And for today's episode, I'm going to give you a peek behind the scenes. I recently had on my personal functional medicine doctor. And when we talk hormones, we talk peptides, this landscape is changing so fast. And in many cases, it's hard to know who to trust and who has the latest information and what's going on the business side of things with these. So whether you do TRT or hormone replacement or looking into peptides, you're healing from injuries, which my doc was able to fix my tendinitis that I had for a year and a half. It was gone just like that. Or whether you need to connect some of your people to, or you want to know how this may affect your business and what's going on. This is an educational section from the best person in this industry that I know of. And I'll tell you why I selected her as my doctor. And then she really gives a huge breakdown. Her and her partner give a huge breakdown on peptides and the specific different ones. I've never been more educated in my life, which is why I brought her on to speak, not just to me and the people that I work with, but I want to share this with every one of you as well. So this will be the most informative talk that you're ever going to hear about this. And there's a lot of Q&A. Some of the gym owners there brought a lot of great questions that you're going to have questions to and you're going to get the answers to. So thought you would enjoy this one. It's a little bit on the longer side, but it's extremely informative stuff that you need to know. So sit back and enjoy it. And should you want to see the actual video with this, where there's the slides and everything like that, you can always check that in the show notes or reach out to me, Scott at The Profit Lifestyle, and I can connect you with that. Thanks a lot and enjoy, guys. Welcome to the Profit Lifestyle for Fitness Entrepreneurs podcast. My name is Scott Carpenter. I am a personal trainer turned multiple gym owner and investor who's already been through the rock bottom and near bankruptcy in the fitness business. But I've been lucky enough to come out the other side and have turned the profits of my fitness business into indestructible wealth. I'll be sharing the no bullshit strategies, tactics, and advice to win big in business and in life. So if you're a gym owner, a personal trainer, or an online coach who wants to make multiple six figures in take-home profit and have the freedom with your time to actually enjoy it, subscribe now to this podcast. This is the show for you. We got an educational one today. So I've got Juliet, Fornick, Rossi, and McKee on with me today. So they are the owners of PremierFunctionalMedicine.com. And I wanted to have them on today for all of us gym owners and fitness entrepreneurs for a few reasons. Number one, I think we all know that hormones, I think we all know that peptides, these are things that are rapidly changing. And every time I talk to somebody, they're kind of like telling me about stuff I did not know. And I'm like, holy shit, I can't keep up. And, this is stuff that is very relevant for us. It affects us business-wise. It affects us health-wise as this technology really takes off. Some of it is absolutely amazing. And to give you an instance, for a long time, I had a client at one of my locations, one of the hardest workers I've ever had. She does all of the workouts. She's 1,000% honest about her food, what she hits and misses. And at a certain point, she's done phenomenal, but I'm like, there's nothing else I can do for you. The math doesn't add up. I know it's a hormonal problem. I've encouraged her to she's going to the doctor that she's going to, her traditional medicine person. It was PCOS, right? But I'm like, it's just not cutting it. And you need to find somebody who is good at this, who knows this stuff beyond your traditional doctor. And so I pointed her way, with Andrea and Michelle's way. They've taken amazing care with her. She's dropped weight like it's nobody's business. And it was the coolest thing because this person is the hardest worker I've ever known, period. Okay. Some of you guys know also from a fencing tournament, I developed some tendinitis. And I've not been able to compete in a year and a half. I have put off going and finding somebody because I know I'm going to go to just your traditional person who's going to recommend some bullshit, maybe a cortisone shot to handle the symptom and not treat the cause. And I'm going to go through this rigmarole. Maybe they're going to give me some shitty PT, maybe not, who knows? But I'm going to have to go through a lot of people. Then I'm like, you know what? I'm just going to hit up Andrea about it, At the same time, the person checking my blood work and hormones too, I wanted to find somebody new as well, just because a lot of the players out there, I don't feel they just really know their craft at all. I feel they just do one thing and they'll same treatment plan for everybody. And I want to I want to dive into health and longevity. I think we all do. That's why we're in this business, you know? So anyways, this was fixed after one treatment, something that had been bugging me for a year and a half. I feel amazing. I've known Andrea's husband for 15 years. He's really high up at NESM and like a science nerd, as they all of them are, which makes me feel comfortable. They don't do the bare minimum. They really dive in on this stuff and know their stuff. And so I trust them. That's who I recommend to everybody and that I work with personally, and they're working with my wife. So I wanted them to educate us today. And that's purely what this is. This is not a sales pitch for anything. I think you guys like me have probably been hit up by different hormonal people that want to do collabs and this and that. I know there's legal restrictions on that stuff too, like with kickbacks. I don't know. Some people are maybe be finding ways around it. I don't know. But the bottom line is this is an educational thing today, and that I want you guys to have. And I want you guys to have a really good resource for yourselves. And I want you to have a really good resource for your clients. Because when you deal with these clients who need some of this help, my worst fear is I send them to some, meathead who just is going to get them all jacked and hook up on stuff, or start charging them $600 a month in supplements, and then they don't have any money to train with us or whatever it is. But I want to put them in good hands with some people who know this business inside out and are going to do the right things. And that's Andrea and Michelle. So they're going to come on. They're going to kind of educate us a little bit today. I want a lot of this to be Q&A for you guys. So if you have questions that come up, even if they're talking, raise your hand or throw them in the chat if we need to wait to the end. So they'll talk a little bit, but the Q&A will be really valuable. They also have a way to kind of work with you guys to do some a consultation and like get you integrated should you want to do that, and have kind of some preferred services for gym owners. But like I said, this is not a sales thing at all. It's purely education, and I want you guys to have a good resource to send people or yourselves. Like Rob, you talked about you've got some arthritis and stuff like that. I know, George, you said you had something and you got some peptides, some shoulder injury, I think it was. And it's just like, bam, it's gone. And like, man, this stuff is pretty amazing, right? When you find somebody who knows it and who can do it safe and all that stuff. So throw questions in the chat as you get them so you do not forget them. That being said, I'm going to hand it over to Andrea and Michelle with Premier Functional Medicine, and let you guys go ahead and share your screen and teach what you want to teach, and then we'll open up the Q&As after. If you can too, I know we got a lot of people on without video on. I know some of you can't always have video on, but if you can do it, we always like to see faces and stuff like that. So go ahead and take it away.
All right. Well, thank you very much for having us, and thanks everybody for joining. We are going to talk a little bit about peptides today. We'll kind of keep it a little bit simple. Most of the slides are a little complex, mostly because I'm a dork and I love science and medicine, if I can get this to come up. So the peptides or the slides are more medical than what we'll kind of talk about. We'll keep it a little more simple. One of the reasons that we actually work with a number of gyms out here in Arizona, because we've had so many clients come in that they took, I don't know, the back room of the gyms where people are like, hey bro, I can get you this or whatever, to build out in their 20s and 30s, like Tren, Deca, things that you can get from your friends that are ordered off of like online. And now they're coming to us and they're really kind of, it's been 10, 20 years from now, their ligaments have ruptured, their bicep is torn off, their quadricep is torn off. And those are things we can't really fix because it's too late. That takes a surgeon, but we're trying to prevent that. We want to create a collaboration where it's a healthy lifestyle. Like that's what you guys are promoting, and that's what we're promoting as well. So she and I I used to compete, and she and I are both very athletic. We work out in the gym, I don't know, a couple times a day, if not less, more, depends. But we want to see people see growth. And we want to see that done healthy. I will tell you right now, the person that's going to be most indebted to you is the person that you give results. So when they come to you, 20 is easy for you, right? 20, 30, their hormones are normal. They've got good energy. There's not a problem. They're ready to put in the work because they're devoted to it. But as we age, it changes. Our hormones change. How we can do things, our metabolics change, and not just that, but like how many things we have to devote our time to. So from a gym owner perspective, from a training perspective, if you can give that client the best results at an early phase, they will be with you for life. You have now created a relationship that's healthy and a devotion that's going to stay for a long time. So, and also from our perspective, from a health perspective, that's what we're looking for. We want the clients that are wanting to be that person and have that health. So they're not coming to us later in life with all of these injuries. So that's kind of where we're talking about with the peptides. I don't know how many people follow with peptides, but over the course of the last couple of years, it's been a bit turbulent with the change of our government now and our RFK. He really is a big proponent of peptides, and he's really brought a lot back. They had come off of the formulary for a bit of time, and the reason being was that most of these are compounded. And because of variability amongst compounders, they took them off of the formulary. The research behind all of these actually comes from human studies for various reasons. Cancer, HIV was a big one. There's a number of different reasons why peptides came around. But because compounders and other professions started looking at these peptides and knowing that they actually worked, the government came in and said, we need to have some more stability. So in this last year and a half, they've brought a number of peptides back, and people are talking about them. They are looking for them. They are looking at the back of the gym. They're looking for their brother who's like, hey, bro, I'm going to help you lift. You want to grow? I'm going to do this, that kind of stuff. The problem is now, though, online, you can get all of these things and it says not fit for human use. There's a reason for it. It's not fit for human use. So we only work with 503B companies, which are pharmacies that are qualified to create these peptides for us. So that's our opening for that. So again, we're just going to talk about cellular aging. This is going on at 20. Everybody's kind of hitting their peak. Your 20-year-old client is pretty easy to train if they are into it, right? They're coming to you because they want to get fit. You can make those changes for them with relative ease, right? There's just diet and exercise and training them in proper form and how to lift. But as we age, we get more complex. So we've got cellular aging, we have physical aging and cognitive aging. And then you hit that social emotional aging, which is, we've had kids, we have a job, we have a partner, we've got so many other responsibilities that are weighing in on us that just don't allow us to train the way we can when we're in our 20s. So it becomes more complex. And that's where you guys are really hitting your challenges, right? They're giving you money, they're not seeing the results. And because they're just overrun. So there's a number of different factors that weigh into aging that we have to account for. One of them is sensias. I don't know if you guys remember, I think it was cellular biology started in like 7th grade or something. So senescence or sensience, however you'd like to say it, is really what a cell does. So all of our cells die. That previous slide, we didn't go into it, but it kind of broke down how each cell functions and how that function from a time standpoint leads to death. It's when the cell is just sitting there, not doing anything is what senescence is. It's not functioning properly. It is actually causing increase in oxidative radicals. It's causing cellular damage. And then that in itself can cause increased risk for cancer. So we want to try to avoid that. And that's kind of where peptides came around. So a peptide is really just a chain of amino acids. If you think about what our DNA structure, again, all of us kind of remember this, but it's variable. So each DNA structure has a number of amino acids, and each amino acid has a role in how our body is producing or functioning. So peptides kind of emulate that. Yeah. Sorry, I'm not speaking properly. I don't know why. So to go into this next couple of slides is just going to look at gains, growth, and wellness. These are for your clients that are looking for decreased adiposity, increased muscle, repair, those types of things. These are the following peptides that we'll talk about. So, come on. Come here, Sermorelin. Sermorelin is one of my favorites. It's actually, I can't ask questions, sorry. So Sermorelin, it really helps so much with sleep. I don't know if you guys are following your sleep, if you use an Oura ring, if you just track it, if you use your watch. But deep sleep is so important for functional recovery. If you've got somebody who's training for competition or just life, they need to get an hour to an hour and a half of deep sleep in order for their brains to store memories, in order for muscle growth to increase or improve. It helps repair our body from the day stress. So we really need to hit that. I can tell you right now, she and I both also work trauma, critical care, and acute care surgery. So we do 24-hour calls at the hospital. Our stress levels tend to be terrible. If I don't take my Sermorelin, I get 45 minutes of deep sleep, maybe less, 30. I wake up and I feel terrible. That's at like 4 to 6 hours of sleep. If I take my Sermorelin and only get 3 hours of sleep, if that, and I get that hour and a half of deep sleep, my recovery is phenomenal. I wake up, I feel good, I'm out, I'm in the gym, I'm lifting, my focus is good, my brain fog is gone. This particular peptide is phenomenal for deep sleep and recovery, which is super important, but also helps with muscle building, primarily because it gets us to that phase of deep sleep. So it is a phenomenal, very easy peptide to take. That's not really, really strong, if that makes sense. So that just goes back into sleep again. So Tesamorelin is a medication or a peptide that I love for central adiposity. What that means is your fat on your abdomen. Okay. So a lot of your clients, as they go into andropause, menopause, perimenopause, and again, we're talking about older patients, even younger ones, our body changes significantly as our hormones change. And because of those hormone changes, our body shifts our fat to our abdomen. A great example of that is, well, me. I am in perimenopause, and I came into the office and I used to compete. So I was pointing at my stomach and I told my partner, Michelle, I was like, what is this? And she's like, what? And I said, what's on my stomach? She goes, fat. And I'm like, yeah, but why? She's like, because you're in perimenopause. And I said, son of a biscuit. So, and I'm telling you, for me, it happened overnight. So it was really quite upsetting. I literally woke up and was like, what the French toast? So I put myself on Sermorelin and it's pretty much resolved. I did 3 months, which is typical for what you would recommend for your clients, is a 3-month phase. And that central adiposity is gone. I gained 10 pounds of muscle in that time frame. That was still under the same amount of duress that I had been under for the last year and a half. So my cortisol levels really hadn't changed. I was still stressed out, but that Sermorelin really changed how my body was functioning. So in a perimenopausal phase or an andropausal phase, it helps create that or recreate the growth hormone that declines after the age of 20. And all of these affect a different phase of the growth hormone. And that's why there are different types. There's Sermorelin, Sermorelin, and as we move forward. But I will tell you, Sermorelin, one of my favorites, works really, really well for central adiposity.
Real quick, Andrea, even Missy chimed in and said the previous one, the Sermorelin is what it is.
Sermorelin?
Yeah, Sermorelin. I checked my Oura ring. I'm averaging probably about 50 minutes of deep sleep. Mm-mm. Missy said that she's on that. And she's getting 2+ hours of deep in REM.
Nice.
And yeah, so not bad.
That sounds phenomenal for it. And it's the reason I like it is because you can take it a little bit longer. Most of these are time limiting and you have to cycle. Mm-hmm. The Sermorelin you can take for a longer phase of time. So it's a nice peptide.
Well, it's the deep sleep time frame too, is when your growth hormone is actually like functioning and rebuilding and helping with that like muscle repair. So that's why we need that deep sleep.
Yep.
Gotcha. Makes sense.
So this is a gentleman that came to me and he's like, I want to train for a competition. I said, okay. And he's got his own trainer. I didn't have to offer him any dietary or muscle building or like how to weight lift, any of that stuff. He had his own trainer. He just wanted a boost. Okay. He's like, this is my year. I want to make it. I said, all right, let's go. So we put him on Sermorelin, and those are 4 weeks of results. That's pretty amazing. That is 15.7 pounds of muscle in 4 weeks gained and 7.8% of fat loss. So that's not even, so he asked me, he's like, do I need to cut my diet? I said, absolutely not. You need to increase your protein, dude. Because he was worried about his change in weight was only like a 3 pound or a 1 pound weight loss. But look at that muscle gain. That's pretty amazing for 4 weeks. And of course he was training and he's 37.
Yeah.
But even at 37, that's pretty good.
Mm-hmm.
So CJC ipamorelin is another medication. The CJC and ipamorelin kind of work synergistically. One is a longer acting, the other is a short acting. And again, just kind of works on a different chain of growth hormone. Increases your metabolism, increases tissue repair, helps with fat reduction, and also helps with muscle gains. How we decide to prescribe each of these is really based on you as a person as you come through our doors. We decide which medication is going to work the best. Medication, peptide, I call it medicine, sorry. To determine which one's going to be the better one. CJC ipamorelin is great in conjunction with other medications. I usually use this my kind of older populations that aren't looking for that faster gain in muscle mass. And then you have your IGF-1. This is insulin-like growth hormone factor. Another great medication for muscle building and fat loss, metabolism increase. This is another one as we age. All of these peptides are things that run in our bodies as we are younger, and then decline after the age of 20. So IGF-1 LR3 is great. Typically what I do is draw a lab panel and look at what their IGF is. If their IGF is exceedingly low, then we prescribe this to see how they respond to it. And it goes back to what they're training for and how they're training to determine which peptide is going to be best. But IGF-1 LR3 is great for doing just a general reset of getting your body back online. This is for usually kind of our clients in their 40s and 50s. They're looking to just kind of boost themselves a bit, get back into a better state of health. This is a great peptide for that. So going into healing and recovery. All right. A lot of people know about BPC 157. Not a number of people know about TB 500. BPC, well, we'll go into it. TB 500 is, in my opinion, one of the best peptides for healing. My husband is a brown belt in jiu-jitsu, and his professor is a black belt, and he tore his meniscus, had surgery. He came to me and he's like, I need to be 100% right away. And I said, well, a meniscus surgery takes 3 to 6 months to recover from, if not a year. It's going to take a little while. You're not going to be on the mat. I said, but we'll start you on TB 500 and see how you do. Most people require about 3 months for repair of acute injury. And he said, perfect. So I put him on in a month. He said, I'm 100%. I also gained 5 pounds of muscle, and he was back on the mat. There was no qualms. His knee was fully repaired, which I think is pretty phenomenal. We've had a lot of patients come in here, not just with chronic, but also acute injury, and acute injury is phenomenal. The repair on it's very, very quick. The recovery is great. I also use it for my clients that just have, well, the number of patients that have come in having had trend injuries where their muscles are kind of popping off the tendons, and they have been like either had a number of bone bone breaks, or just like life in general, I put them on it and they are back to feeling really good within 3 months. I have 2 stroke patients, which is where TB500 is primarily studied, is in the neuroregenerative space. So I have 2 stroke patients, one of whom is a cardiothoracic surgeon that I used to work with. During a case, he had a stroke. He was at the wrong hospital. And so he developed hemiplegia, which is where one side of your body doesn't work anymore. And we put him on it and he's walking with assistive aids. But, and again, you know, you can't really say where he'd be otherwise, but he is walking. He said his function, his growth, everything. Even his doctors have proclaimed how well he's doing just by being on this medication. And it's highly studied in that arena. And it's a fabulous medication. I love it for repair of injury. BPC 157 is what I think most people talk about if you're in the gym or just talking to people in general. BPC 157 is a good recovery agent as well. I like it for gut healing. If somebody has like IBS or Crohn's, I typically will put them on the oral phase of this. And it's got very good results for kind of cooling things off and repairing that epithelial layer, skin layer of the intestines. Oral, any peptide is going to be broken down because they're all proteins. Preferentially, you want injectable because of that first pass effect. So for a peptide, if you take it orally, same as kind of any peptide or protein, your stomach breaks it down, so you lose a certain percentage. And then as it passes through the liver, you lose another percentage. So some of these things, you might take them at 100% of that medication. By the time it actually hits your system, it's 20, 30%. So that first pass effect is very impactful. That's why most of peptides are injectable. The BPC 157 orally does actually work really well for gut health. Because it's oral, it's absorbed through that epithelial layer, so it's great. The injectable form is also good. It's just not as systemically profound as TB500. So when somebody comes to me and if they have a very specific injury, for example, tennis elbow, you can use that and you can inject it right into that space where there's pain, and it will definitely help promote healing and recovery. But for the more global or like intense injuries, my preference is TB500. Going into cognition and memory, I don't know how many people tell you all the time, as you know, we age, we can't focus. There are a couple different medications that you can take for that. One of them is super easy, Synapsin, love it. It is just like taking Afrin or anything else that's an intranasal that you just take once a day in the morning when you wake up. And they've studied this, again, going back to like neuro injuries and strokes. They've studied this highly in the stroke and dementia populations, and it's actually shown to reduce your risk for dementia. And those that are already in that pre-dementia phase prevents that or it decreases that acute onset. It's a great medication. I've been on Synapsin for, I don't know, since I was 30, and I'm old now. And it really, really does work. It's a great medication for delaying the onset of dementia, Alzheimer's, helps us focus and stay focused with very minimal side effects. In fact, none. The side effects were none. Pinolon is another one. This is for people that are worried about their cognition. And usually this is your population that comes in, that's your andropause and your menopause phases. They're like, I cannot focus. This medication's great. I take it once a year for 3 months. And what it does is decreases your oxidative stress. It's one of the few medications, again, or in line with synapsins, that crosses the blood-brain barrier. And it works really well for cognitive function, decreasing Alzheimer's, decreasing your risk for dementia, or slowing the onset of those. So it's a very good medication to take annually. It's not something you take all the time, but it works really well for decreasing that brain fog, increasing your mental focus, the things that people typically complain of as they're aging.
Missy has a question too. She said, any benefits of a BPC 157 / TB500 combo oral? or is it broken down too much?
Orally or injectable?
Or I think she's talking about the combo and both orally, it looks like. She says, or is it broken down too much?
Yeah, I mean, orally, you're gonna have a lot of breakdown. You still get benefits, but they're very mild. BPC 157 is a gastric hormone, so that's why it does so well and benefits the gastric area. TB 500 is not generally. I mean, that's not where it is like produced. I mean, because majority of these peptides are amino acids and hormones that we are creating and that have been recreated and developed, so they are more beneficial injectable.
Yeah. Are all the peptides like bioidentical, or do some of them vary a little bit?
They are bioidentical, yes.
Yeah.
Okay. So we're going to move into weight loss, which I know a lot of you are rolling your eyeballs, but I'm telling you, some people do need this adjunct. And again, it's going to be more of a benefit to you as a trainer than a negative. So go ahead.
So, I mean, everyone, of course, knows about GLP-1 antagonists. They're medications that are out on the market now that initially have come out for, type 2 diabetes. They are very well studied. Honestly, they've been around since 2005. That was when the first series of GLP-1s came out. And by accident, they found that these diabetics are losing all this weight. So within the last several decades, they found that with these medication, it doesn't just also regulate your blood sugar, but it's reducing that appetite because of the slower gastric motility that occurs with these medications, making that fullness for those patients taking these medications. With that, it also then supports the metabolism. All through the studies, though, they found that these patients are improving their cardiac benefit and their stroke benefits from these medications, because it's not just lowering and controlling those blood sugars, but it's also protecting their heart by lowering their blood pressures and decreasing that A1Cs that we find in so many of our patients and the older population too. As we get older, we have a less ability to control that insulin balance. So these medications are a great adjunct for a lot of these clients, especially in women and men that are going through that, menopause or, menopause, because our ability for our metabolism to function is decreased immensely. So these medications are a great adjunct to help them lose that weight, to get them back on to that ability to train harder and work out better and just feel more comfortable in their skin. So to be honest, I know like we've said, we work with a lot of gyms out here, and it is hard for a lot of our gym owners to kind of accept that like, oh, they're, taking the easy way out. But there are so many of your clients that it's not the easy way out, it's the only way out. So like, this is their ability to actually function and and perform at the level that they want to perform at. So, and not even that, but the studies coming out are just so protective of their health benefits in so many other ways. So it is a real benefit to introduce to a lot of different clients. So I'll let you do that. Next, we'll talk about testosterone, one of our favorite topics when we deal with in our clinic here. This is such an important hormone in men and women. Of course, everyone thinks it's, primarily a man's hormone, but so many women benefit from this replacement. And we, at the age of 30, we start to decline in our levels by 1% every single year. So by the time you're in your 40s, you have, like 300 to 400 decimals less than you had when you began. So if you were in your 20s and 30s, you were at 600, you're probably in the 300s now, which is very low. That contributes to your sexual health, your mood, your energy, how you can build muscle or retain muscle, your bone health for osteoporosis, and just that cognitive health. And then for women, by the time we're 40, it has decreased by 50%. So women are walking around with no libido, and we have no energy, and we are total la la land with our brain fog. So ultimately, We try to help our clients come in here and we, look at all their hormones and see what their levels are at. And then we will provide them with a recommendation of if they need replacement. Not everybody needs replacement because they're the lucky ones and they can hold on to that testosterone, but majority they are a much lower rate and requiring that to see the benefits of, that muscle build and actual like sexual health. So, and then that kind of leads us into our next topic, which is primarily, I wouldn't say it's just for women because there are some hormone replacements outside of testosterone that men can benefit from, but perimenopause and menopause is a huge part of women as they age, starting in their 40s. We start to see the change that occurs. We start to see the night sweats and the brain fog and the anxiety and our mood changes. And ultimately that's because our levels of estrogen, progesterone, and testosterone are going in the toilet. So coming in and checking your labs and whether it be us or someone else and just knowing where your baselines are at, even at a young age. I have so many clients that come in at a young age so that they know what they're starting at so that they can see what's happening to them as they get older. Because ultimately, as you get older, it's a fluctuating number. And if you don't know where you started at, you'll never know if you're low or not, because textbook numbers are not your numbers. You could be right in that normal range.
Give it a second. They've got a lag. They'll be back in, back out, I bet.
Okay, I think we're back.
Okay, they're back.
I can give you a great example of that. Was I actually, because I've been in medicine for several decades at this point, I tested my hormones very early in my life, in my 20s, and I kept those results so I would know. I started feeling terrible, and I couldn't figure out why. I went to my primary care provider, and I was like, I have no energy. I can't get testosterone. And she said it was some ridiculous number. It was like 50. In my 20s, I, again, am probably a bit of an anomaly as a female, but I ran closer to 200. So I was like, that's really low for me. I said, I need to be on supplementation. And she said, absolutely not. We're not putting you on that. 50 is fine. For women, we can be 0 per the FDA standards to 50 or 60, which is highly unacceptable. So I went on supplementation. I went to a functional medicine provider at that point, which is kind of what started to drive where I was going to go in medicine, because they understood I was naturally running at 200. So when I hit 50, I felt terrible. I need to be around 200 to feel good and function. So that's kind of one of the reasons why we highly recommend getting your labs. If you've got children, have them have their labs drawn around the age of 20, so they have that basic physiologic number for them to understand what their normal is. It's super important for men. Most men run around 800, sometimes a little bit higher, to feel good, to feel like you have the energy, the focus, the sex drive, all the things that are important to a male and female alike, to build muscle. Testosterone is actually very protective from a cardiovascular standpoint. Also decreases your risk for osteoporosis, men and women alike. They recently published a paper that says that we can actually keep your estrogen for men higher. So this is one thing for you or your clients to be very cognizant of. This is very old school, and I still have people coming through our doors that are saying, we went here and they put us on an estradiol. So they put them on an estrogen blocker. It's very, very old school. If you remember, testosterone was associated with like heart attacks and strokes. That was because they put them on an estradiol. So men, women alike need estrogen. It is very cardioprotective for both genders. So we don't do an estradiol unless there's a very clear reason for it. I maybe have 2 of 500 of our clients that are on, and there's a very specific reason for it. And I use the lowest dose possible. We need estrogen. The published data that just came out actually increased males' estradiol level, which is our active estrogen, up to 80. They said that is much more healthy. So if you are talking to your client and they're like, I'm on testosterone and an estradiol or some sort of estrogen blocker, you want to counsel them on that, because that is actually not healthy, and there has to be a physiologic reason for it. It's so important to go to a provider that is staying on evidence-based practice and knows what's happening in current literature and data and studies. And there's just so many people that don't. There's so many providers that actually don't in the functional medicine world, which is kind of sad, but something to kind of keep in the back of your head when you're talking to your clients.
And when we say cardioprotective, we're talking like you need that hormone to benefit you. Did you just put them? You need that hormone for your heart to function at a normal level. So ultimately, that's a very important hormone for men and women.
You'll have to share your screen again since it when there's lost connection, it unshared it. So try. You might have to hit stop sharing and then reshare it again if it's you're seeing it, but we can't. This is really good, and I'm going to interrupt you for 2 seconds just for quick questions on it.
Yeah.
This was more when we were just wrapping with peptides and stuff, but Mike asked, like, anyone with certain health conditions or illnesses that a client has that shouldn't be taking these, like heart issues, lung issues, heart attacks, CPOD. And I guess you could answer that in reference to peptides and these kind of hormones too, as well.
So peptides, I mean, they increase blood flow and healing. So we have to take that into consideration for anyone who's taking a peptide. That also known tumors or known cancers that you have in your body, if you were to have cancer, that also will feed that cancer. So taking a peptide, yes, you do need to be careful with if you have any risk of any kind of like, if you have a known cancer, if you have a history of cancer, or if you have like close related, cancer or tumors, the peptides are something that you want to really investigate and see if that's right for you and research on that if it's something appropriate for you to start. Because that is the one of the bigger risks when taking peptides, because it's increasing like blood flow and vasculature and for that healing portion of it. So that is a big, in all the research it does cover. So
they haven't really shown any data up to this point that it increases your risk. The assumption is that it does, because it does increase cellular proliferation, which is like cellular repair and longevity. So if you had an active cancer, then the assumption is that it would also increase that risk for cancer. Because what cancer is, essentially, to bring it down to a very simple analogy, is one cell that's kind of gone crazy and just continues to replicate itself. That's essentially what cancer is. So if you're giving it a source for replication, then that would be the risk.
Yeah.
As far as testosterone goes, there is some studies are correlating a little bit higher lipid panel. So we just kind of look at what their inflammatory lipids are, like your alpha lipoprotein B, what their global lipid panel is before we consider going on a testosterone therapy. The other one is that it can increase your hemoglobin hematocrit. And to be honest, that's a pretty easy fix, and it's actually a helpful fix, because if somebody is sitting high, they just go and donate blood, usually like 1 or 2 times a year, and that gives back to the community too. So there's a way to compensate for the greater majority of those side effects.
Perfect. And then, yeah, Shauna also asked, do you do blood work in-house or outsourced? You do both, correct? Because you can do it in-house, but I'm at the other end of the valley, so I wasn't going to go there just to draw blood too. So you just sent the stuff to LabCorp. I actually had LabCorp come out to my house because I'm lazy. And they drew my blood, and yeah, you get all the stuff.
Mm-hmm.
Yeah.
The one thing that's kind of nice, we want somebody they're coming in, they're obviously in some sort of, for the most part, most of the people that come through the door have an issue they are concerned about, and we want to make that as easy as possible. So we draw all of our labs here. They're usually back the following day, with the exception of a couple hormones. And we can get things going relatively quickly for people in that regard. So it's kind of nice.
Excellent. And Missy also asked, do you use the within 10 years window of menopause, whether natural or surgical, for hormone therapy, especially estrogen?
Absolutely. Yes. So to speak to the Women's Health Initiative, I don't know if you're referring to that study. It was they just
released a new study.
There's been a number of studies since that point in time, but what the Women's Health Initiative looked at was Premarin, which is a non-bioidentical hormone replacement therapy. And they also, the whole population that they used in that study that they published, don't use estrogen, don't use progesterone, was 60 plus, and a number of them already were predisposed to the disease processes that occurred. The current data that they've studied using bioidentical hormone replacement therapy has very, very limited risk or associated risk of cancer. So we control symptoms using our lowest dose possible for the shortest time period you can, to control for those, to get you through it, because it will end and you will readjust to your new life. But absolutely, we use that 100%.
So can I just point out, guys, this is why I love these two. They are nerds. Like, they are just legit nerds. They look at every single damn new study that comes across. Whereas, I mean, I think we all know it's not just the medical industry. It could be an attorney or whatever. It's like they'll give you vague general statements and then they don't really dive into this stuff. And this is such cutting edge stuff, is you've got to be on top of it. And I just wanted to add, that's why I really trust these two, because they are just, you're nerds. Your husband's a nerd. You guys have always been nerds. And that's who I want, like, looking and making the recommendations about this stuff, because you geek out on it, which is really cool.
No,
We agree. We're nerds.
yeah, we're nerds.
Yeah. And Dino's asking about like state lines and stuff, because because these gym owners are all over the place, right?
Right.
And if whether they want your help or they got clients, how does that work if you were to work with somebody across state lines and stuff like that? He says, any issue across state lines. So if in North Carolina and blood test info is sent, can peptides, testosterone be prescribed or shipped to another state? Also, are individuals doing their own injections?
Most of our clients do their own injections, so that's not a thing. Going across the state lines isn't a difficulty for most states. I think there's 5. Hawaii, California is always temperamental because it's California, and a couple others that are a little bit more difficult to navigate. But for the most part, across the U.S., we are able to provide care doing the Zoom interviews, and we can see your labs as long as we order them or you send them to us if you have them ordered through somebody else.
We do a lot of telemed.
Yes.
That's good to know. That is good to know. Okay. Is that kind of the wrap on your slides? Because we can open up to more Q&A and stuff too.
Yeah, ultimately, we just want to make sure everybody knows, we're here as a resource. We want to help and be an adjunct to whatever you're providing for your clients, and just improve their performance and then just improve, their outcomes. So ultimately, we want to be utilized for that. And just if you have questions or, areas of that you have a need for, that's what we're here for.
Even
Awesome.
if you have just your clients come to you and ask you questions, what supplements should I take? If you want to even look at that, there's things we did not cover, things like NMN or NAD, what kind of hormone replacement or supplementation you can do without doing hormone replacement. We're happy to do that. Our whole goal of opening up this company is to provide care and longevity. We want people to be at their optimum health because we think it's important. So that we're here for whatever questions you might have.
Excellent. Yeah, we got a couple more coming across too. Is this all cash or any insurance applicable? Thanks, great presentation and much needed.
Insurance is usually run through, we will do your labs through your insurance, and everything else is pretty much cash based.
Yeah.
Just because it's all compounded medications, peptides are compounded. So it's not something that insurance covers at this point. That may change in the future.
Yeah. Whatever meds we can send through a normal pharmacy, we definitely attempt to do that. But the majority of the medications that we're utilizing are compounded.
Yeah, because like sometimes there's a thyroid thing that falls in, like the stuff that you can categorize under health insurance, you do, and then but a lot of this stuff, you guys know how insurance works, right?
Yeah.
They
It's
don't
real painful.
pay out for anything. So in a few years, we'll see. What gets covered and what isn't. And then HSA, are HSA accounts able to be used for this? Probably,
Yes.
right?
Yeah.
The
Yeah.
one thing that I will tell you, at least in the state of Arizona, any purchases you make as far as health goes, keep your receipts. You can use them for Arizona state tax, and that offsets your federal tax. Again, being a nerd.
Let's speak in my language. I'm a financial nerd, so speak in my language now. And Kai's got a question. I've heard experts recommend both methods, but do y'all, he's from Texas, do y'all typically recommend starting with peptides before hormones to let the body naturally improve hormone production, or do you start with hormones?
That's a great
And then,
question.
yeah, we'll go with that one. He's got a second part on that one too.
All right. It totally depends on really, we look at labs, right? And we look at who you are, what age you are, what you do from a like just a functional status, from a day-to-day functional status.
And what your ailments are though too. So
To determine if we're going to start with hormone replacement therapy, if we're going to try a peptide. Peptides work great for rejuvenation. For like when I first started my perimenopausal phase, which I'm aging myself, but I don't care. I did the Tesmorelin and the IGF, and it pretty much put things into cessation for my symptoms into cessation for probably 6 to 8 months. But I mean, it's an inevitable process for me, so it's not going to not come back. So I don't know if that answers your question, but it depends on which hormone you're talking about, and what symptoms you're talking about as to what we kind of decide what pathway is going to be best.
And we have lots of clients that use them in conjunction with each other. I mean, we have an abundance of hormone replacement clients that are utilizing our peptides because, they want more muscle gain or they want injury repair. And so there's lots of reasons why to do both.
Case by case basis. And
Yeah.
you guys were talking about before too, like, I mean, there's, your traditional medicine, you're going to fall within a normal accepted range, which we know is not.
Yeah.
And then there's also, so they obviously they're going to more the optimal thing according to how the body functions and works. And then they also had mentioned, of course, that varies a bit from person to person, right? What your baseline is, right? And yeah, it's very individualized, right? Is what I'm getting. Rick's got a question too. What about using DIM or DIM instead of estrogen blocker? God, I'm going to sound like such a dumbass because I can't even pronounce it. I don't know if it's aromatase or it's pronounced differently, inhibitors with TRT, he said.
Again, it goes back to
Why are you
using it?
Yeah. So we find now that a lot of the times people were placed on, estrogen blockers because men saw that their estrogen levels were going up and they didn't feel like they needed that hormone at the level that they were at. But it's studies are showing that we definitely can run men at a higher estrogen level, and those blockers are inhibiting a lot of other things. So ultimately, it just depends. If you have like extreme gynecomastia, if you have other like symptoms like, certain types of baldness or like hair distribution that you from estrogen and just other symptoms because your estrogen levels are too high for you, then yes, a blocker is appropriate. But ultimately, in many cases, you don't need a blocker.
Okay.
In answer to that question, yes, you can absolutely use those. They do work. There's a number of different type of supplements that you can use to bring your estrogen levels down.
Yeah.
But so to go into the physiology of it, and again, I'm going to nerd out, but all of us, andropause, menopause, what happens is as our hormone shifts, we get that central adiposity or that fat on our stomach, our blood vessels, our actual blood vessel lining inflames and becomes thicker. Our lipids or cholesterol actually goes up because our central adiposity has gone up. So our lipids now become a problem. And then with the inflammation to our blood lining, the lipids kind of stick to the vessels, and then you get atherosclerosis, which leads to heart attack and stroke. Studies have shown to reduce that risk, men need estrogen. They need their estradiol levels to between 60 and 80. That's the newest data. So you have to be very, very careful about blocking that. Very careful about blocking it.
And some of that kind of goes into Casa's questions too. Well, he had mentioned, with some of these peptides and hormones that they all through injections or their oral options as well. You hit on some of that. Some can be done orally, but a lot like they need to be injected because it your body breaks some of it down, right?
The best absorption, because it is a peptide, because it is a protein, the injection is best absorbed. Otherwise, like I talked about, you get that first pass effect where it breaks down in the stomach and then further breaks down as if it has to pass through the liver to be filtered. So most, if not all, with the exception really of BPC 157 and DHEA, really are injectable, and they're small injections. It's not like your testosterone where you kind of have to get it into the muscle. It's subcutaneous, typically into the stomach using an insulin syringe, so it's quite tolerable.
Oh, that's good to know for clients, right? It's just you're kind of
It's
scared
not
of that kind of stuff.
Yeah.
Okay. And those are just like little tiny things that just go. I've seen diabetics use them. They just barely prick it, right?
Yeah.
Okay. And then I'm sure this is a bigger question, but like he also asks also what are the potential side effects of using hormones and peptides? Obviously, they'll vary depending on which ones, but
they do vary upon which ones. So again, going back to any of the peptides, like if we're talking about the strength ones, well, really all of them, to be totally honest, they really are just affecting that growth hormone phase. And it goes back to cancer, right? So if you have any of that as a base, then you're increasing that risk. If you have a tumor or you have an active cancer cell, you're increasing proliferation or replication of that. Again, the studies haven't really shown that, but the assumption is as much based on how they function. Testosterone for women, men, some people are very, and it's surprising to me because they've done a number of studies. So everybody's like, I'm going to lose my hair. I'm going to grow a beard, all of the things that can happen. For women, they worry about having increase in clitoral size, that type of thing. So there are things that you want to watch for. Some people are very sensitive to it. Some men, some women will actually have hair loss with it. Most people do not. Some people will have a bit of hair growth, so they may get like a little bit more facial hair. Men don't concern themselves so much with that. I think what's the popular the testicular shrinking. Oh, men, there is this thing there, like my testicles are going to shrink, and that's actually not the case. If there's a caveat for men, if you are trying to get pregnant, if you are on testosterone and your testosterone levels are high, your sperm levels drop across the board. So we always counsel people in that regard. If you are trying to get pregnant actively, then your testosterone, you should not be on testosterone replacement.
There are other medications that you can help that won't affect that infertility portion of testosterone replacement that we can also counsel you on that if it's a younger male. So
we have several patients that are on it, and then they're going to try to have children. So we take them off and we put them on other medications to boost their testosterone or their sperm counts back up, and typically don't have an issue with it.
It's a good thing that I'm kind of like helping to host and facilitate this, because I would be in the chat comments, I'd be making penis and vagina jokes all day long. I don't know how any of us got through that with a straight.
I was surprised how well she did with the clitoris.
That was really good, sneaking that one in there. Thanks. Like it was nothing. That was good.
I don't know how else to say it, but I will say right now that clitoral injection, that's a big fad. Everybody's fad. Everybody wants a big clitoris. So.
Oh, is that the new thing these days?
Yeah.
What
it's actually for the last year has been a big thing. Yeah.
We offer that here too.
This is great. I know there's even more questions, and I want to get this one because in case somebody's got to jump off right at the hour. But Sean and other people thumbs up. They're like, how can I go about getting on a call with you? I want to make sure in case anybody's got to jump off at the end of the hour. How do people get in touch with you? What's the best way?
They can use our website. There's direct. You just make a appointment through the website. Our phone number's on there, and they just call. And once you're our client, you have our personal cell phone numbers. Everybody does, because again, it goes back to we want to know what's going on with you, and we state like once somebody starts a journey in our practice, it's a journey. So we're doing it with you. It doesn't matter. Like we want to know what's going on. We get texts. I mean, I was just in Thailand and I can't tell you how many texts I got day and night and responded to all of them. I don't go on vacation. When you're our client, you're our client, and we're here 24/7.
That's a big thing, guys, too. So like I was kind of surprised as we started working. I was traveling. I was at like an event and stuff like that. And I called you and I'm like, hey, I need to find for me, I need somebody new. My doctor actually died, believe it or not. And I've been meaning to go to her. It's just, you know what I mean? I had a loyalty thing, whatever.
You had to wait till someone died.
Yeah, I had to wait till somebody died. And then I called her up and like, we were on cell phone and texting and she was setting paperwork for the blood work. I got home, I got it done. Like, it's awesome. It's awesome. So, and I put it in the chat. So premierfunctionalmedicine.com. You know, tap that, bookmark it, right? But premierfunctionalmedicine.com, they are really good with that stuff, which is amazing. And then I know there's other questions, and if you guys got to go at the top of the hour, that's no problem. Do you guys have 5 more minutes for another couple questions, or do you guys have
Absolutely.
Okay. Let me scroll up real quick. Somebody asked about just like on the business side of stuff, right? Like, are you working with other businesses to refer patients as a percentage with commissions, you know, and stuff like that? Now, I know that there's a lot of gray area with that, and we're getting hit up sometimes with people to do stuff like that. It might be on the supplements. Who knows? I just know I've not been hopping on a lot of calls with those people, right? Like, because a lot of times there's medical stuff with kickbacks that you cannot do, right? I know from a life insurance angle, it's highly illegal for me to send affiliates and referrals. And so how does some of that stuff work on the business end of things?
Well, we're kind of limited to that just based on our license, in that we can't take kickbacks, we can't do any of that thing. We work with people that we trust. That's it. So we work with certain pharmacies. We don't get kickbacks from them. We get no monies back. Same thing with the supplement world.
Yeah.
You really we as a profession, because of our licensure, can't do that. But as far as like, if somebody was asking, hey, so we work with a lot of gyms out here, and based on what type of gym it is, if it's a trainer, if it's like a HIIT gym or whatever it may be, depending on who our client is, because we want them working out, right? That's a longevity standpoint. So we refer them to that gym. But it's not a kickback thing. It's because we want them to work out, and we know that they can get them to be in the space where they need to be. Because it's not just the medications, it's not the peptides, it's not the hormone replacements. They have to change lifestyle.
Yeah.
And sometimes, and a lot of the times, they need that coach to help them do that, not just us. We can't make them go work out. But we want them to. So if we can find a gym that's compatible kind of with their energy and lifestyle, then we send them to that particular gym.
Yeah, we have no affiliation with any pharmacies or any other like medical groups, but ultimately when a client comes in, yeah, our main focus is what's your diet, what's your activity, what's your protein at, what's your, what are your steps? Like, we're focusing a lot of that, because that is encompassing everything. Like, that's our goal, is that we want to, longevity and wellness. So ultimately that's what we want to do.
Yep. So you know how some doctors will just, hey, here's your drugs, see you later.
Yeah.
Right. And that's it. I mean, that's how our health industry is.
Yeah.
Right. It's nothing else. Don't worry about any lifestyle changes, that and the other. So they're going to work with you, with your clients with this. Yeah. It'll go hand in hand. Should you need to have like, hey, I got some clients who need some help with this. You don't have to worry about, you know what I mean, them just doing their stuff and then they stop coming to you. It's actually going to be the opposite. They're going to encourage that. Right. They work with, they know multiple gym owners and work with multiple gym owners. And they live it. Right. I mean, they both work out like crazy. They live the lifestyle. It's not no, just take this and you'll be good. So they're going to help support you and your business when it comes to this kind of stuff.
I just had a client that came in that wanted to do weight loss. So I put her on a GLP-1. She had just come from her primary care. Now, mind you, we're both founded in traditional medicine as well as functional medicine. We practice trauma, critical care, and acute care surgery. So our background is critical illness as well as functional medicine. So we're very broad in our approach, as well as like our education. But this woman came from her primary care provider who wanted to put her on a statin for her high cholesterol, wanted to put her on metformin for her glucose, had her on blood pressure medication, did not counsel her whatsoever on weight loss or exercise. So I said, can we just hold for a minute? Can we give us 3 months? I said, let's work together for 3 months. I put her on a GLP, lined her up with a gym. She started working out, as well as dietitian. So she was on all 3 things. at her 3-month recheck, the only thing that stayed elevated, like her hemoglobin A1C, which for those of you who don't know, is a 3-month picture of what your glucose is. So your blood sugar, if it stays elevated or high, then you're pre-diabetic. Nobody wants diabetes. I'm telling you, if you can avoid it, that would be best. Her A1C went from 6.5, which is almost close to being diabetic, to 5.2 in 3 months. She dropped 28 pounds. The only thing that stayed elevated was her lipids or cholesterol, and that's because it was more familial. So she did end up going on medication to control for that. But everything else was controlled. Her blood pressure came back to normal. She dropped weight. She was feeling good. She was exercising. She was eating right. So that's kind of what we're trying to do. And we need you guys to be able to do that, because we don't train people. That's not our background. We train ourselves. Maybe I should have trained her, but but yeah, we definitely need people that can help them get to that space.
Yeah, excellent. We'll do one more too, and we'll let everybody go. What's the general price range for peptide therapy, et cetera, kind of stuff?
Depends on, peptides are a little bit on the expensive side because they're difficult to compound. So it can be anywhere, depending on which one from $300 to $600 a month. And again, these are not things you stay on for life. You usually will, like for example, TB 500 is variable. I have some people that are on it for a month and they feel perfectly fine thereafter, don't need to go on it again. Other people, 3 months. If you have had like spinal cord injury or stroke, then you're going to stay on it for 6 months. So each one is very individual as to what we're trying to achieve determines the amount of time that you stay on it. But it's anywhere from 300 to 600, 1 month to 3 months, and you cycle on and off. So it really depends on what our goal is.
And what about like hormone therapy and stuff like that, or any of that stuff?
Sure. It ranges also depending upon what route you take. If you're doing an injectable, testosterone injectables for men, about $180 a month, for women's $140. If you're doing creams or troches, which are sublingual type of medications, that varies from anywhere from $45 to $75 a month. And it just depends on what hormones you are required to take for replacement.
Excellent. Excellent. Okay. Well, hey, thank you both for being on. I don't know if this is the most informative thing I've ever heard on this. And obviously I think it's pretty clear these two know what they're talking about, and so much more than anybody else that I've ever talked about or considered. And this is why I delay, like I've delayed fixing the tendinitis that I had. I've delayed all this stuff just because I didn't want to go through the rigmarole of me figuring out who actually knows their shit and who doesn't, and going to like 6 different people. I just put that off for way too long. But I'm very glad that I found these two, and they know their stuff. And so yes, whether you want to do it for you, right? Like it's for you, and you've got stuff you want to talk to them about, or whether you want to just create a great relationship for the people that you need to send your clients to. Definitely, check them out at premierfunctionalmedicine.com. premierfunctionalmedicine.com. Andrea and Michelle, thank you so much for coming on and sharing all this education. It's massively valuable. I needed this really, really bad because I've been not spending a lot of time looking into it.
Well, thank you so much for having us. We really appreciate it.
Yeah, excellent. And you'll find their contact information. You'll have their email. You'll have their phone number. So anything you have, guys, I encourage you to shoot it off to them because this is what they do. They're here to educate. They're here to help, whether it's you or whether it's your clients. So thank you very much. Really, really appreciate it. Everybody will get this recording as well. So if you need to research back and look back on anything, we'll have it. And I encourage you to send it to anybody else who needs to get this information as well.
Perfect. Thank you.
Thank you, everybody. Appreciate it. Listen, if you're stuck and could use some advice in your business, whether you're just starting out, a veteran in the business, or expanding online or into multiple locations, you can hop on a free call with us to pick our brains at ptlegends.com/one-on-one call. You can see that in the show notes. That is with numbers. Chances are we'll be able to help you get some clarity on what you need to do specifically in your business to get to the next level. It's not a sales call. We'll connect you with the right resources to help you solve your problems. But if you want to learn more about working with us, that's cool too. We can share that information should you want it. So book your call now to get out of the rat race before your week consumes you, which is easy to do at ptlegends.com/one-on-one call. That's with the number 1 on the number 1 call. You can find this in the show notes. See you soon.